Hey everyone, welcome to our comprehensive guide on the cardiovascular system. Essential for every nursing student out there. Whether you're prepping for exams or just brushing up on your knowledge, this video will break down everything you need to know. Today we'll dive deep into the key components and functions of the cardiovascular system. By the end of this video, you'll not only grasp the intricate workings of the heart and blood vessels, but also feel confident in applying this knowledge in clinical settings. So, grab your notes, sit back, and let's embark on this educational journey together. Trust me, mastering the cardiovascular system will set a strong foundation for your nursing career. Ready? Let's get started. Alright, let's kick things off with an overview of the cardiovascular system, also known as the circulatory system. It's responsible for transporting oxygen, nutrients, hormones, and waste products to and from cells. Think of it as an intricate highway system that keeps everything moving smoothly. The cardiovascular system consists of the heart, blood vessels, and blood. The heart acts as the pump, driving blood through a network of arteries, veins, and capillaries. This system works tirelessly to ensure that every cell in your body gets the oxygen and nutrients it needs to function properly. Understanding the anatomy and physiology of the cardiovascular system is vital for nursing practice. So let's dive deeper into this fascinating system and see what makes it tick. Now, let's zoom in on the heart itself. The heart is a four-chambered organ located in the thoracic cavity, nestled between the lungs. Despite its small size, it's incredibly powerful, pumping around 70 milliliters of blood with each beat. The heart's upper chambers are called the atria. The right atrium receives deoxygenated blood from the body via the superior and inferior vena cava, while the left atrium receives oxygenated blood from the lungs through the pulmonary veins. Below the atria are the ventricles. The right ventricle pumps blood to the lungs for oxygenation, and the left ventricle pumps oxygenated blood to the rest of the body. Valves within the heart ensure unidirectional blood flow. We have the atrioventricular AV valves, the tricuspid and mitral valves, and the semilunar valves, the pulmonary and aortic valves. Now let's trace the blood flow through the heart. Deoxygenated blood enters the right atrium from the superior and inferior vena cava. From there it flows through the tricuspid valve into the right ventricle. When the right ventricle contracts, it pushes blood through the pulmonary valve into the pulmonary arteries, which carry it to the lungs for oxygenation. In the lungs, carbon dioxide is exchanged for oxygen, and the now oxygen-rich blood returns to the heart via the pulmonary veins into the left atrium. The left ventricle, the heart's most muscular chamber, then contracts and pumps blood through the aortic valve into the aorta. The aorta distributes oxygenated blood throughout the body, delivering vital oxygen and nutrients to tissues and organs. Chapter 4. The conduction system. Let's talk about the heart's intrinsic conduction system, which regulates its rhythm. The sinoatrial, or SA node, often referred to as the pacemaker, initiates electrical impulses that trigger heartbeats. Located in the right atrium, the SA node sets the pace for the heart's rhythmic contractions. From the SA node, electrical impulses travel to the atrioventricular, or AV node. The AV node, situated at the junction between the atria and ventricles, delays the impulse. The bundle of His then transmits the impulses through the interventricular septum to the Purkinje fibers, which spread throughout the ventricular walls. The conduction system is critical for maintaining a steady and synchronized heart rhythm, ensuring efficient blood circulation. Chapter 5. Blood vessels. Moving on to blood vessels, the highways of the cardiovascular system. Arteries carry oxygenated blood away from the heart, with the exception of the pulmonary arteries, which carry deoxygenated blood to the lungs. Arteries have thick muscular walls to withstand high pressure from the heart's pumping action. Veins, on the other hand, return deoxygenated blood to the heart, except for the pulmonary veins, which carry oxygenated blood from the lungs to the heart. Veins have thinner walls than arteries and contain valves that prevent backflow, ensuring blood flows in one direction toward the heart. Capillaries are the smallest blood vessels, forming an extensive network where gas and nutrient exchange occurs. Understanding the structure and function of these vessels is crucial for recognizing how blood circulation supports overall health. Chapter 6. The cardiac cycle. The cardiac cycle encompasses all the events associated with one heartbeat, It consists of two main phases, diastole and systole. Diastole is the relaxation phase during which the heart chambers fill with blood. The atrioventricular or AV valves, the tricuspid and mitral valves, are open during this phase, allowing blood to flow from the atria to the ventricles. Systole is the contraction phase where the ventricles contract and pump blood out of the heart. During systole, the AV valves close to prevent backflow into the atria, and the semilunar valves, the pulmonary and aortic valves, open to allow blood to be ejected into the pulmonary artery and aorta, respectively. Understanding the cardiac cycle is essential for interpreting heart sounds and recognizing abnormalities that may indicate underlying cardiac conditions. Chapter 7. Blood pressure and regulation. Blood pressure, or BP, is the force exerted by circulating blood on the walls of blood vessels, measured in millimeters of mercury, or mmHg. It consists of two readings: systolic BP, the pressure during ventricular contraction, and diastolic BP, the pressure during ventricular relaxation. Several mechanisms regulate blood pressure to maintain homeostasis. Baroreceptors located in the carotid arteries and aorta sense changes in blood pressure and send signals to the brain to adjust heart rate and vessel diameter accordingly. The renin-angiotensin-aldosterone system, often abbreviated as RAAS, also plays a crucial role by regulating blood volume and systemic vascular resistance. Understanding these regulatory mechanisms is vital for managing conditions like hypertension and for administering appropriate interventions to maintain optimal blood pressure levels. Chapter 8. Cardiac output. Cardiac output, or CO, is the volume of blood pumped by the heart per minute, a crucial measure of heart function. It's calculated by multiplying heart rate, HR, by stroke volume, SV, which is the amount of blood ejected with each heartbeat. Several factors influence cardiac output, including preload, afterload, and contractility. Preload refers to the initial stretching of the cardiac muscle fibers due to blood volume in the ventricles at the end of diastole. Afterload is the resistance the heart must overcome to eject blood. Higher afterload, often due to hypertension or narrowed arteries, can reduce stroke volume and cardiac output. Understanding cardiac output and its determinants is essential for assessing cardiac function and guiding interventions to optimize heart performance. Chapter 9. Coronary circulation. Let's focus on the coronary circulation, the heart's own blood supply system. The coronary arteries branch off from the aorta and encircle the heart, ensuring it receives adequate oxygen and nutrients. The right coronary artery supplies blood to the right atrium, right ventricle, and part of the left ventricle. The left coronary artery divides into two main branches: the left anterior descending, LAD artery, and the circumflex artery. The LAD artery supplies the front and bottom of the left ventricle and the front of the septum. The circumflex artery supplies blood to the left atrium and the side and back of the left ventricle. Blockages in these arteries can lead to ischemia and myocardial infarction, commonly known as a heart attack, highlighting the importance of understanding and monitoring coronary blood flow. Chapter 10. Common cardiovascular conditions. Now let's discuss some common cardiovascular conditions. Hypertension or high blood pressure increases the risk of stroke, heart attack, and kidney disease. Heart failure leads to symptoms like edema, fatigue, and shortness of breath. Myocardial infarction or heart attack occurs when a coronary artery is blocked. Arrhythmias are irregular heart rhythms caused by issues in the heart's conduction system. Understanding these conditions helps nurses provide effective care and educate patients. Chapter 11. Nursing considerations. Let's talk about nursing considerations for cardiovascular health. Nurses monitor cardiovascular health by checking vital signs and auscultating heart sounds. Promoting heart-healthy diets and physical activity is crucial. Educating patients on medication adherence is essential. Assisting with ECG monitoring and stress tests is also part of the role. there.